April 12th, 1945. Stadtkrankenhaus Hospital, Würzburg, Germany. Sister Maria Steiner stood in the hospital courtyard at 14:37 hours, staring at 3 dying American soldiers on stretchers. She was 34 years old, head nurse, trained at the University of Heidelberg in 1932, when medicine still meant something beyond ideology. The Americans lay bleeding onto canvas, their uniforms dark with blood that pooled beneath the stretchers and mixed with dust from yesterday's bombing. The youngest, a sergeant with shrapnel wounds across his chest and abdomen, looked perhaps 22. He was trying to speak, his lips forming German words he had learned somewhere, asking for water in broken syllables that came out wrong. Maria looked past him to the hospital behind her. 180 German wounded filled a building designed for 460 beds. The March 16th bombing raid had killed 5,000 civilians in Würzburg. 3 days ago, another raid collapsed the hospital's east wing. Now 920 patients occupied spaces meant for less than half that number. Men lay on floors, in hallways, 2 to a bed when beds existed. She had 47 nurses where she once commanded 89. 12 doctors remained from 34. In the pharmacy, morphine sufficient for 3 more days sat in locked cabinets. Sulfur, drugs, for 5 days. Bandages were being washed in boiled water and reused until they disintegrated. The American sergeant was still trying to speak. His eyes followed her face, pleading. Maria turned to the 2 orderlies who had carried the stretchers from the street. "Take them to the basement," she said. "The boiler room. Give them water. Nothing else." The younger orderly, barely 17, hesitated. "Sister, they're dying." "We have 40 German soldiers upstairs who will die without the morphine these 3 would require," Maria said. The mathematics were simple. The ethics, she told herself, were equally clear. These men brought the bombs that killed our people. Our duty is to our own first. The orderlies carried the stretchers toward the basement stairs. The American sergeant's hand reached toward Maria as they passed. She did not take it. Maria had served on the Eastern Front from 1942 to 1943. She had witnessed 14,000 German casualties at Stalingrad, had worked 72-hour shifts in field hospitals where frozen limbs snapped like wood, and men died faster than bodies could be cleared from operating tables. She had returned to Würzburg with a clear understanding of what war cost. Her nephew, 19 years old, died at Normandy last June. Her brother went missing after Kursk in 1943. The Americans now dying in her basement were part of the force that had destroyed her city, killed her neighbors, turned her hospital into a makeshift shelter where children screamed through the night. The Ministry of Health Directive of 1943 had been explicit. When German casualties were present and medical resources were limited, enemy combatants received treatment only after German needs were fully met. The directive carried the force of law. Maria had followed it without question because the alternative meant choosing enemies over her own people, and that choice seemed not just wrong, but obscene. At 14:52 hours, Dr. Wilhelm Hoffmann arrived. He was 51, trained in surgery at Berlin, skilled enough that his hands could repair damage other surgeons declared hopeless. He examined the Americans briefly, timing their pulses, checking pupils, assessing the wounds with practiced efficiency. When he returned to the courtyard, his face showed nothing. 6 to 8 hours, he said. The sergeant has internal bleeding. The private with the leg fracture has infection setting in. The corporal with the chest wound has a punctured lung. All 3 are salvageable with immediate surgery. "And the cost?" Maria asked. "Operating theatre for 6 hours minimum, 3 units of morphine, sulfur drugs for post-operative infection, plasma if we have it, bandages, sutures, surgical supplies." Hoffmann paused. "Enough resources to treat 12 German soldiers with less severe wounds." Inside the hospital, a young nurse named Greta Albrecht had been listening. She was 23, trained during the war when nursing school had been compressed from 3 years to 18 months. She stepped forward now, her voice careful. "I could assist with the surgeries, Herr Doctor. The Americans are wounded soldiers. The Hippocratic Oath doesn't specify nationality." Maria turned to face her. "The oath is to healing. Healing our people first when resources are scarce. These men destroyed our city 3 weeks ago. 5,000 civilians died. How many of those do you think these 3 killed personally?" "They're soldiers following orders," Greta said, "like our men." "Our men didn't have the luxury of bombing from safety," Maria said. "They died in mud and snow, fighting an enemy that now sits in our hospital, demanding our medicine." She looked at Hoffman. "The Americans stay in the basement. Water only. No medical treatment." At 15:11 hours, orderlies placed the 3 Americans in the boiler room. The space smelled of diesel fuel and blood. A single bulb provided light. The American sergeant asked again for water. An orderly gave him a canteen. When the sergeant asked for a priest, the orderly shook his head and left. At 16:34 hours, artillery fire sounded closer than before. The American advance had been systematic, grinding through German defensive positions with overwhelming material superiority. Intelligence estimated the 3rd Infantry Division was 4 kilometers east. The hospital would be in American hands within 48 hours at current advance rates. Everyone in Würzburg understood what was coming. The only question was how the Americans would treat Germans who had denied treatment to American wounded. At 16:58 hours, an American jeep appeared at the hospital entrance. It flew a white flag and bore Red Cross markings on its hood and doors. The driver stopped in the courtyard. A man in American uniform stepped out, captain's bars on his collar, medical corps insignia on his sleeve. He was perhaps 28, with the careful movements of someone accustomed to operating in hostile territory. 3 enlisted men followed him, all wearing medic armbands. The captain approached Maria directly. "Captain James Mitchell, 45th Evacuation Hospital. I'm here to negotiate treatment for American wounded. We have medical supplies we can offer in exchange." Maria's voice was cold. "We don't negotiate in hospitals, Captain. We treat patients according to our resources and priorities." Mitchell reached into his jeep and removed a wooden crate. He set it on the ground and opened it. Inside, packed in straw, were glass bottles of morphine, paper packets of sulfur drugs, containers of plasma, and rolled bandages still in sealed wrappers. 500 units of morphine, 200 sulfur packets, 50 plasma units, sterile bandages, enough to save 30 German soldiers by my estimation, in exchange for treating 3 Americans. "Why would you give supplies to save Germans?" Maria asked. "Because they're patients," Mitchell said. "That's what medics do." Maria stared at the supplies. 30 German soldiers, men who would die without morphine, who would lose limbs without sulfur drugs, who would bleed out without plasma. 30 lives against 3. The mathematics favoured accepting, but accepting meant collaboration, meant treating the enemy, meant betraying everything she had told herself about duty and loyalty. "I need to see your wounded first," she said. Mitchell nodded. "They're in your basement. I was told they were taken there 3 hours ago." "You were told? Your hospital isn't as isolated as you think, sister." Mitchell's voice carried no accusation, just fact. "May I see them?" At 17:15 hours, Maria led Mitchell down the basement stairs. The basement smelled of blood and diesel fuel. The single bulb cast shadows that made the 3 Americans look already dead. Mitchell moved quickly to each stretcher, checking pulses at the neck, lifting eyelids, pressing fingers against abdominal wounds to assess internal damage. His examination took 4 meters. When he straightened, His face showed controlled anger. Sergeant Kowalski has maybe 6 hours. Internal bleeding from shrapnel. Private Chen's leg fracture is infected, spreading fast. Corporal Murphy's lung is collapsed. All 3 are salvageable with immediate intervention. Mitchell turned to Maria. You have the skill to save them. You're choosing to let them die. Maria gestured toward the stairs. Come with me. She led him to the 2nd floor where German wounded filled every available space. Men lay on floors because beds had run out days ago. A 19-year-old soldier with both legs amputated at mid-thigh lay sweating through bandages, his face grey with pain. No morphine remained for him. Beside him, a 34-year-old corporal with gangrene blackening his left arm waited for tomorrow's amputation. The hospital had no anaesthesia to spare. He would be held down while a surgeon cut through bone. These are our choices, Captain, Maria said. Save 3 enemy soldiers or use those supplies on 15 German men who fought for their country. Mitchell studied the ward for 30 seconds. Then he said something Maria did not expect. Show me your maternity ward. At 17:43 hours, they climbed to the 3rd floor. 23 pregnant women occupied a ward designed for 15. 7 were in active labour. 3 had delivered within the past 24 hours. In the corner bed, a woman named Elizabeth Hartmann, 28 years old, had been in labour for 4 hours. The baby was breech. The midwife attending her looked exhausted and frightened. Without an obstetrician, without the capability to perform a caesarean section, Elizabeth and her baby would both die. In another bed, premature twins born 3 hours earlier at 32 weeks struggled to breathe. Their skin showed the bluish tint of insufficient oxygen. The hospital had no incubators, no supplemental oxygen, no equipment for respiratory distress. A 19-year-old girl lay bleeding heavily after delivery, her pulse rapid and weak. Across the ward, a newborn girl lay silent in her mother's arms, the umbilical cord having been wrapped around her neck during birth. She breathed, but poorly. The 2 midwives on duty had been working for 18 hours straight. Neither had training in neonatal care beyond basic delivery. The ward had no sterilisation equipment beyond boiling water. Complications meant death because the hospital simply lacked resources to address them. Mitchell assessed the ward with the same quick efficiency he had shown in the basement. 4 babies will die within 12 hours without intervention. 2 mothers are critically unstable. You have no equipment and no trained personnel for these complications. We've been doing everything we can, Maria said. The words came out defensive. We have no supplies for obstetric emergencies. My medics have obstetric training, Mitchell said. We have paediatric supplies, infant resuscitation equipment, antibiotics your military doesn't have access to. Let us help. Maria stared at him. Why would you save German babies? They're babies, sister. Mitchell's voice carried no judgment, only statement of fact. What kind of medics would we be? At 18:15 hours, Mitchell called his team from the jeep. Corporal Thomas Bradley had been an obstetric nurse in Chicago before the war. Private Samuel Washington had trained as a midwife assistant. Private Michael Romano carried field medical experience from 14 months of combat. They brought equipment in canvas bags, infant resuscitation apparatus, sterilised surgical kits, glass vials of penicillin that German forces could not manufacture, portable oxygen cylinders, feeding tubes thin enough for premature infants, umbilical clamps, and sealed delivery kits wrapped in wax paper. Bradley examined Elizabeth Hartmann at 18:34 hours. He confirmed the breech presentation, noted the baby's heartbeat, dropping with each contraction. The German midwife, a woman named Ingrid, watched with skepticism as Bradley scrubbed his hands and arms in boiled water, then coated them with some clear solution from a bottle. Maria stood against the wall, arms crossed, waiting for the Americans to fail. Bradley's hands moved with precision learned through hundreds of deliveries. He manipulated the baby internally, working between contractions, talking constantly to Elizabeth in English that Ingrid translated into German. At 18:56 hours, the baby emerged. A boy. He did not breathe. His skin showed blue-grey. Bradley handed the infant to Romano, who had a rubber bulb device Maria had never seen before. Romano used it to clear the baby's airway with gentle suction, then provided rescue breathing with careful technique, his mouth covering the infant's nose and mouth, delivering small puffs of air measured to tiny lungs. At 18:58 hours, the baby cried. The sound cut through the ward. Elizabeth, barely conscious, reached for her son. Bradley placed the baby in her arms, then administered an injection of penicillin to prevent post-delivery infection. Maria watched the entire sequence. An enemy medic had just saved a German mother and her child using equipment and techniques her hospital did not possess. Washington moved to the premature twins. He created makeshift incubators using hot water bottles wrapped in blankets, demonstrating precise temperature regulation. He provided supplemental oxygen from portable tanks, adjusting flow rates while teaching the German midwives exactly how much oxygen premature lungs required. He showed them a feeding technique using tubes and measured amounts of milk. Within 30 minutes, both twins' breathing stabilized. Their skin color improved from blue tinge to pink. Bradley turned his attention to the hemorrhaging mother. He identified retained placenta through examination, then performed manual removal with care that minimized additional trauma. Mitchell administered plasma from bottles Maria's hospital had exhausted weeks ago. The woman's blood pressure, 60/40 when Bradley began, rose to 90/60 within 20 minutes. Her bleeding stopped. By 21:30 hours, all 4 critical cases had stabilized. Bradley spent an additional hour teaching German midwives the resuscitation techniques, demonstrating the equipment, explaining the procedures in careful detail that Ingrid translated. 12 German nurses watched, including Greta Albrecht. They saw Americans saving German lives with supplies, skill, and complete lack of hesitation. Maria observed everything. She had refused to treat 3 Americans dying in her basement, citing limited resources and duty to her own people. These Americans had just used their resources to save 4 German babies and 2 German mothers. They had asked nothing in return. They had not mentioned their own wounded still dying 1 floor below. They simply saw patients who needed help and provided it. The question forming in Maria's mind was simple and devastating. If they would save German babies without hesitation, who exactly was the enemy? At 21:45 hours, Maria called an emergency staff meeting in the hospital chapel. The chapel was the only undamaged large room remaining after the bombing. 47 nurses assembled along with Dr. Hoffman, 3 other doctors, and 2 administrators. Maria stood at the front, exhausted from 40 hours without sleep, and presented the question that would divide her staff. Should they accept American medical supplies and treat American wounded? The room split into 3 groups almost immediately. Nurse supervisor Helga Richter stood first. She was 41 years old, a Nazi Party member since 1933, and her voice carried absolute certainty. Accepting help from the enemy is collaboration. Treating them is treason. Our sons died fighting these men. Now we should heal them. 7 other nurses stood with her. The SS still operates in this region. They execute defeatists and collaborators. We all know this. Helga's husband was an SS officer. No one knew where he was stationed, but his existence shaped everything she said. She invoked Hitler's Nero decree from March 19th, the order to destroy everything rather than let it fall to the enemy. We should maintain our principles until victory or death. Nothing less honors the sacrifice of our soldiers. Dr. Hoffman spoke next, and 23 nurses moved to stand near him. Medicine is not politics, he said. 500 units of morphine will save 30 German soldiers. That is a mathematical fact. Whether we like the Americans or hate them is irrelevant. Our duty is to the wounded, whoever they are. 2 other doctors joined him. The American army will control this hospital within 48 hours, regardless of what we decide. We should cooperate now rather than face consequences later. The third group formed around Greta Albrecht. 16 nurses, most younger than 30, stood with her. I watched the Americans work for 3 hours, Greta said. They saved 4 German babies and 2 German mothers. They did not hesitate. They did not ask for anything in return. They treated our people exactly like their own people. Her voice grew stronger. If we let men die who we could save, we are no better than the regime that brought us to this moment. Medicine should have no nationality, only patience. The generational divide was clear. The older nurses remembered Germany before the war, before the ideology, but also remembered the losses that ideology had promised to avenge. The younger nurses had grown up with the ideology, but were now watching it collapse around them. Between these groups stood Maria, head nurse, the one whose decision would determine what happened next. The meeting ended at 22:34 hours without consensus. Maria dismissed the staff and remained alone in the chapel. She sat in the front pew where she had sat hundreds of times before the war, when this building had been simply a place of worship, rather than the only intact large room in a destroyed hospital. Her medical training had begun in 1932 at the University of Heidelberg. She remembered the oath ceremony, the words spoken by every student, primum non nocere. First, do no harm. Treatment based on need, not identity. The physician's duty to all patients equally. Those principles had seemed clear then, before politics infected medicine. By 1938, new directives arrived. Race-based medical priorities. Certain patients received full treatment. Others received limited care. Some received none. Maria had followed the directives because they came from authorities she had been trained to respect. On the Eastern Front in 1942, she treated 14 wounded Soviet prisoners. She saved all 14 lives. The army commended her for her skill. In 1943, new orders arrived forbidding treatment of Soviet wounded when German casualties were present. Several Soviet soldiers died in her field hospital that winter. She had followed orders. The guilt from those deaths never left her. Now she remembered the American medic's face as he worked to save Elizabeth Hartman's baby. Bradley's concentration, his skill, his complete lack of hesitation. The baby had been German. The medic had been American. The nationality meant nothing to him. Only the medical need mattered. He had demonstrated the principles Maria had learned in 1932, the principles she had abandoned somewhere between then and now. At 0:17 hours on April 13th, shouting erupted from the German ward. Maria ran from the chapel. A young German soldier named Hans Müller, 21 years old, lay writhing on his bed. His appendix had ruptured. Dr. Hoffman examined him quickly and delivered the diagnosis with clinical precision. Without emergency surgery within 2 hours, infection would spread through Müller's abdomen and kill him. The problem was immediate. Hoffman could perform the surgery. He had done hundreds of appendectomies. But the hospital had no anesthesia beyond minimal local numbing agents. Hoffman could operate with the patient awake, though the pain would be severe. The greater problem was post-operative care. Without antibiotics, the infection from the ruptured appendix would kill Müller within 3 days of surgery. The hospital's sulfur drug supply was nearly exhausted. Müller was from Würzburg. His parents lived 3 blocks from the hospital. He had been conscripted 6 months earlier and wounded in his first combat engagement 2 weeks ago. He was crying now, 19 years old, calling for his mother. At 0:34 hours, Greta found Maria in the hallway outside the ward. "The Americans have penicillin," Greta said. "Enough to save him." Maria stood silent for 40 seconds, calculating. One German soldier's life, against accepting help from the enemy, against maintaining her ideological position, against telling Muller's mother that her son died, because Maria's pride mattered more than his survival. At 0:41 hours, Maria walked to the basement where Mitchell's team was sleeping in the corner on blankets they had spread over the concrete floor. She stood above Mitchell until he woke. When he sat up, she spoke with difficulty, choosing minimal words because more would have broken something inside her. "We have a German soldier. His appendix ruptured. He needs penicillin, or he will die." Mitchell stood immediately. "How much do you need?" No negotiation, no conditions, no reminder that 3 Americans still lay untreated 10 feet away, dying because Maria had refused them care hours earlier. Just a simple question about medical needs. At 0:56 hours, surgery began in the main operating theatre. Hoffman performed the appendectomy with Mitchell assisting. Bradley scrubbed in to help. His surgical skills, trained in American hospitals with abundant resources and modern techniques, exceeded those of the German nurses who typically assisted. The operation lasted 47 minutes. Muller's ruptured appendix was removed. The infection site was cleaned. Mitchell administered penicillin at precise dosages, explaining to Hoffman exactly how the antibiotic worked and how much Müller would need over the coming days. At 2:13 hours, Müller was sleeping in recovery. His vital signs were stable. The infection risk was minimal with continued penicillin treatment. Maria stood beside his bed, watching the rise and fall of his breathing. The American medics had returned to the basement without comment. Their 3 wounded countrymen remained untreated, still dying, still waiting. Maria had watched Americans save a German soldier and asked nothing in return. They had proven something she did not want to acknowledge. They were better than her, not militarily, not in strength or resources, morally better. They treated enemies with the same care they would treat their own. She had refused care based on nationality. They had provided it based on need. At 6:30 hours, after 47 hours without sleep, Maria made her decision. Maria entered the hospital administrator's office at 6:30 hours. Klaus Brenner sat behind his desk, 58 years old, Nazi Party member since 1937, more concerned with institutional survival than ideology. He looked up as Maria closed the door behind her. "We will treat the American wounded," Maria said. "Immediately, with full resources." Brenner's face showed concern rather than outrage. "The SS still operates in this area. If they discover we are treating enemy soldiers..." "The SS is not here," Maria interrupted. "The Americans are 3 kilometers away. In 24 hours, they will control this hospital. I will not face them having let their men die from ideology while they saved our people from medical need." She presented the practical argument because Brenner understood survival better than principles. American goodwill would protect the hospital staff when occupation began. American supplies had already saved 5 German lives, 4 babies and 1 soldier. Medical ethics required treatment regardless of nationality. But more importantly, the hospital's reputation and staff safety depended on cooperation. Brenner listened, calculated, and nodded approval. At 7:15 hours, Maria assembled the full staff in the main hall. 47 nurses, 4 doctors, the remaining administrators. She delivered her announcement in 3 sentences. All wounded would receive treatment based on medical need, not nationality. The operating theatre would be prepared immediately for American casualties. German patients would continue receiving care without reduction in quality or priority. Helga Richter walked out. 7 nurses followed her. 39 nurses remained. Greta Albrecht's expression showed visible relief. Dr. Hoffmann nodded once, a gesture of approval Maria had not realized she needed until she received it. At 7:34 hours, Maria walked to the basement. Mitchell was awake, sitting beside his wounded men, checking their pulses in the dim light. "Captain," Maria said, "we are ready to treat your men." Mitchell stood slowly. "Thank you, sister, but there is something you should see first." He led her through the hospital and out to the courtyard. In the early morning light, Maria saw what the Americans had built while she slept. A field aid station occupied the corner of the courtyard. Canvas tarps stretched between posts created shelter. Medical equipment lay organized on folding tables. Bradley and Washington were treating German civilians. A 67-year-old man with shrapnel wounds from yesterday's artillery fire sat on a stool while Washington cleaned and dressed his injuries. An 8-year-old girl with an infected leg wound waited nearby with her mother, too frightened to enter the hospital where soldiers died. A 42-year-old woman, severely malnourished, receiving examination for tuberculosis. A 14-year-old boy with a broken arm from a building collapse 3 days earlier. Mitchell explained that they had established the aid station at 5 o'clock that morning. Since dawn, they had treated 23 German civilians. No payment required. No documentation demanded. No questions asked about political affiliation or war support. People who needed medical care received it. Maria watched Bradley work on the elderly man's wounds with the same careful attention he had given to Elizabeth Hartmann's complicated delivery. The Americans were using their medical supplies freely on German civilians, while their own 3 critically wounded soldiers still waited for treatment. They had not asked permission. They had not negotiated. They simply saw people who needed help and provided it. "Your men are dying," Maria said to Mitchell. "Why are you treating our civilians?" "Because we can," Mitchell answered. "Let's go save all of them." At 8:30 hours, 3 operating tables were prepared in the main surgical theatre. The hospital's remaining doctors and nurses worked with focused efficiency, preparing instruments, sterilizing equipment, organizing supplies. Mitchell's medical supplies were integrated with the hospital's diminished stock, creating combined resources sufficient for complex procedures. The first surgery began with Sergeant Kowalski on the center table. Dr. Hoffmann operated with Mitchell assisting. The shrapnel had perforated Kowalski's intestine in 3 places, lacerated his liver, and caused significant internal bleeding. Hoffmann's hands moved with German surgical precision, trained in techniques developed over decades of medical advancement. Mitchell provided plasma the German hospital had exhausted weeks ago, supplied antibiotics that would prevent the infection that killed most abdominal wound patients, and offered suggestions based on American surgical innovations Hoffmann had never encountered. Maria observed the entire procedure. She watched a German doctor save an American soldier with assistance from an enemy medic. The collaboration required no discussion of politics or ideology, only medical terminology, anatomical landmarks, and procedural decisions. At 11:47 hours, Kowalski's surgery was complete. His vital signs were stable. Hoffmann estimated 90% survival probability with continued antibiotic treatment. At the second table, Bradley operated on Private Chen's compound leg fracture. The infection had spread deep into muscle tissue. Many surgeons would have chosen amputation as the safest option. Bradley spent 3 hours cleaning the wound, removing all necrotic tissue, setting the bone with precision that required perfect alignment of multiple fracture points. Greta Albrecht assisted, watching Bradley's technique with visible fascination. He explained each step while working, teaching her bone-setting methods she had never seen. The penicillin injections controlled the infection that would have cost Chen his leg. At 10:23 hours, Bradley closed the final sutures. The leg was saved. At the third table, a German surgeon named Dr. Ernst Klein operated on Corporal Murphy's chest wound. The collapsed lung required drainage and reinflation. Washington assisted, providing chest tube equipment the German hospital did not possess. He demonstrated drainage technique while Klein worked, explaining the physiological principles in careful detail that a translator converted to German. Klein learned an American emergency procedure that would save lives long after this surgery ended. At 9:54 hours, Murphy's lung was reinflated. His breathing normalized. While the surgeries proceeded, German nurses provided post-operative care. Women who had refused to treat Americans 12 hours earlier now adjusted morphine drips, checked bandages, monitored vital signs. One nurse who had lost her son at Anzio brought water to Kowalski when he woke briefly from anesthesia. She adjusted his pillow without speaking, then returned to her other patients. The transformation required no dramatic announcement, only the quiet decision to treat patients rather than maintain hatred. At 1400 hours, all 3 Americans were stable in recovery beds. Mitchell's supplies had been used on 3 American soldiers, 5 German military patients, and 23 German civilians. The ratio meant nothing to the American medics. Each patient had received identical care standards. Bradley returned to the courtyard aid station to treat more civilians waiting for care. Maria stood in the recovery ward, watching German nurses tend to American soldiers, and understood what had changed. Medicine had returned to being medicine rather than an extension of warfare. Word spread through the hospital by afternoon. German patients learned that Americans had saved their lives. Private Hans Müller, recovering from emergency appendectomy, discovered at 1600 hours that the penicillin preventing his death had come from enemy medics. He lay silent for several minutes processing this information, then asked to speak with Captain Mitchell. Mitchell came to Müller's bedside. The young German soldier struggled to find words in his limited English. Finally, he simply said, "Thank you." Mitchell nodded and moved to his next patient. No ceremony, no speeches, just the acknowledgement that one human being had helped another survive. In another bed, Major Klaus Weber, a 44-year-old Wehrmacht officer wounded 3 days earlier, requested an audience with Mitchell. Weber had fought at Kasserine Pass in 1943, one of the few German victories against American forces in North Africa. He had professional respect for American combat capability. Now he was discovering something else. "I fought your men in Tunisia," Weber said in careful English. "You were formidable opponents. You are also honorable men." Mitchell's response was simple. "Medicine is not war, Major. Different rules apply." Elizabeth Hartmann arrived at the hospital at 17:30 hours. She brought what little food she could spare, a small loaf of bread and 6 eggs, precious commodities in a starving city. She found Bradley in the courtyard aid station, treating a woman with infected burns. Elizabeth waited until he finished, then approached with her baby wrapped in blankets. "You saved my son's life," she said through tears. "I have nothing to repay you except this." She held out the food. Bradley looked uncomfortable. He had treated hundreds of patients during 14 months of combat. Gratitude still made him uneasy. "Ma'am, you keep that food for your baby. We have enough. Just seeing him healthy is enough payment." Other German mothers formed a line behind Elizabeth, each wanting to thank the American medics who had saved their children. Bradley retreated into medical work, the only language he understood better than gratitude. By evening, 39 nurses remained on duty. 4 of the 8 who had walked out with Helga Richter returned quietly during the afternoon shift, asking to resume their positions. Maria accepted them without comment. Actions mattered more than words. Only Helga and 3 hardline supporters stayed away, isolated by their ideology, while the hospital continued functioning without them. Greta Albrecht was promoted to assistant head nurse at 1800 hours. Maria made the announcement during the shift change. Greta had proven herself willing to challenge authority when medical ethics demanded it. That courage deserved recognition. The younger nurses saw someone from their generation elevated to leadership, suggesting that the old ideology would not dominate the post-war world. Maria spent the evening observing American medics' work. She maintained a careful count. 47 German patients had been treated since the Americans arrived, 3 American soldiers. The ratio was 47-3, yet the Americans showed no resentment, made no demands for preferential treatment of their own. Each patient received care based on medical need alone. Mitchell demonstrated this principle most clearly at 2000 hours when a resupply truck arrived from the 45th Evacuation Hospital. He divided the new supplies without consulting anyone. 60% designated for German patients, 40% for American wounded being treated at other locations. He did not announce this division. He simply organized the supplies accordingly and returned to work. Maria watched this quiet allocation and understood something fundamental. The Americans were not performing propaganda. They were not trying to win converts. They were simply practicing medicine according to principles they had never abandoned. Principles Maria had learned in 1932 and lost somewhere between then and now. At 4:30 hours on April 14th, pounding shook the hospital's main doors. 3 SS officers entered with 12 soldiers, all armed. They were led by Sturmbannführer Otto Dietrich, 38 years old, Waffen-SS, a man whose faith in final victory remained absolute despite evidence of imminent defeat. His eyes scanned the main hall and immediately identified the problem. American medics treating German civilians. German nurses caring for American wounded. "This is a collaboration," Dietrich announced. His voice carried the certainty of someone who had never questioned orders. "The penalty is execution." He ordered his soldiers to arrest the Americans. He commanded that the American wounded be removed, a euphemism everyone understood meant execution. Maria stepped forward, positioning herself between the SS soldiers and the recovery ward where Kowalski, Chen, and Murphy lay healing. "These men are medical personnel under Geneva Convention protection," Maria said. Her voice was steady despite the rifles pointed in her direction. "This is a hospital. You have no authority here." Dietrich's laugh was harsh. "I have the authority of the Führer. Step aside or face execution for treason." 12 SS soldiers raised their weapons. 4 American medics stood unarmed. 39 German nurses watched. The hospital held hundreds of wounded who could not flee. Maria understood that challenging the SS meant death, but she also understood that some decisions defined who you were. She did not move. Dr. Hoffman stepped forward to stand beside Maria. Then Greta. Then all 39 nurses formed a line between the SS and the Americans. They were medical personnel, trained to preserve life. They would not step aside while armed men came to kill patients under their care. The standoff lasted for 17 seconds. Then Major Weber, wounded, pushed himself up from his hospital bed. "You will have to shoot German soldiers first, Sturmbannführer." 15. Other, wounded. Wehrmacht soldiers sat up or stood, those who could manage it. They positioned themselves with the nurses, protecting the Americans who had saved their lives. At 5:12 hours, artillery fire sounded very close. American forward units were less than 1 kilometer away. Dietrich calculated his options. He could execute 50 Germans to kill 4 Americans, but the American army would arrive within hours. The massacre would be documented, and its perpetrators would face consequences. His soldiers looked uncertain, Several had family in Würzburg. They recognized nurses from the city, soldiers from their own units. Dietrich promised a reckoning after final victory. But everyone in that hall knew there would be no victory. The Third Reich was collapsing. The SS officer withdrew at 5:23 hours, leading his men out into a dying regime. The hospital resumed its work. German patients had protected American medics. The transformation was complete. At 11:34 hours, American tanks entered Würzburg. At 12:07 hours, soldiers from the 3rd Infantry Division reached the hospital. Colonel Robert Harrison of the 45th Infantry Regiment expected resistance or hostile civilians. Instead, he found German nurses treating American wounded while American medics treated German patients. The scene contradicted everything combat had taught him to expect. Mitchell briefed Harrison on what had occurred. The German hospital had provided full medical care to American casualties. German staff had protected American medics from SS execution. The head nurse had defied armed soldiers to maintain medical neutrality. Harrison made immediate decisions. The hospital was designated a protected medical facility. German staff would retain their positions. American and German wounded would be treated together. The 45th Evacuation Hospital would co-locate here, creating a combined facility with integrated resources. Official collaboration began at 12:45 hours. The combined hospital operation began immediately. Over the following 2 weeks, American doctors and German doctors shared operating theatres without discussion of nationality or politics. German nurses and American medics worked in teams, combining techniques and knowledge. The supply pool merged completely. Patient nationality became irrelevant to treatment decisions. Between April 14th and April 30th, the hospital treated 847 patients. 412 were German military, 289 were American military, 146 were civilians of various nationalities. 73 surgeries were performed, 37 by German doctors and 36 by American surgeons. The mortality rate was 3.8%, lower than either German or American facilities had achieved operating separately. On May 8, 1945, the war in Europe ended. The hospital continued as a collaborative facility through the occupation period. Maria Steiner remained as head nurse through 1946. Dr. Hoffman became chief medical officer and served until 1958. Greta Albrecht studied in the United States on a medical exchange program from 1947 to 1949, then returned to Germany to teach nursing at the University of Heidelberg. Captain Mitchell stayed in Germany through 1946, working on medical reconstruction efforts. Helga Richter was arrested by American authorities, processed through denazification proceedings, released after signing documents renouncing Nazi ideology, and never returned to nursing. The 4 babies saved by American medics on April 12th all survived to adulthood. Elizabeth Hartman named her son James after Captain James Mitchell. The premature twins grew healthy despite their difficult start. These children became walking proof of what happened when medicine transcended politics. James Hartman would tell people throughout his life that he existed because an enemy soldier decided babies had no nationality. The 3 American soldiers made full recoveries. Sergeant Kowalski returned to Ohio and became a pharmacist, spending 40 years filling prescriptions in Cleveland. Private Chen kept his leg, despite the severe infection and compound fracture. He walked with a slight limp, but returned to California, attended medical school on the GI Bill, and practiced family medicine for 36 years. Corporal Murphy recovered completely from his chest wound, made the Army his career, and retired as a colonel in 1972. In 1946, the United States Army Medical Corps documented the Würzburg case in an official report titled Cooperative Medical Operations, Würzburg Municipal Hospital, April 1945. The report identified the hospital as a model for post-war medical cooperation and recommended similar approaches in other occupied territories. Military investigators interviewed Maria extensively. She described her transformation from refusing treatment to protecting American medics, crediting the Americans' actions rather than their words. "They showed us what medicine should be," she testified. "They treated our enemies better than we treated our own conscience." Mitchell submitted his own report, recommending German staff for official recognition. He cited Maria's courage during the SS confrontation and documented how German patients had physically positioned themselves to protect American medics from armed execution. The Army awarded Maria the Meritorious Civilian Service Award in 1947, a rare honor for a German national. Dr. Hoffmann received an official commendation. The Würzburg Hospital was designated a model facility for international medical cooperation. Maria lectured at nursing schools throughout Germany from 1947 to 1968. She taught medical ethics, focusing on the principle that healthcare transcends political boundaries. An entire generation of German nurses received training emphasizing universal care standards regardless of patient nationality. In 1952, she published a memoir titled Healing Beyond Borders. The book became required reading in German medical schools through the 1980s, ensuring that thousands of healthcare professionals learned about the moment when ideology gave way to ethics. Mitchell continued serving in the Army Medical Corps, retiring in 1965 as a Major General. He worked in the Surgeon General's office from 1958 to 1962, advocating for stronger Geneva Convention protections for medical personnel and facilities. In 1970, he established an international medical relief organization that operated in conflict zones worldwide. He credited the Würzburg experience as the formative moment of his career, the proof that medical professionalism could overcome even the hatred generated by total war. The Würzburg case became a standard study in German medical education. Every ethics course taught it as an example of healthcare professionalism prevailing over destructive ideology. The story demonstrated that medical neutrality was not weakness, but rather the highest form of professional courage. During the Cold War, the story was suppressed in East Germany because it contradicted Soviet narratives about American behavior. In West Germany, it was celebrated as an example of reconciliation and used extensively in building the United States-German alliance. In more recent decades, international medical organizations have referenced the case repeatedly. The International Committee of the Red Cross cited it in 2003 when discussing medical neutrality in combat zones. In 2015, a documentary titled The Nurses of Würzburg brought the story to new audiences. In 2019, a memorial plaque was installed at the hospital entrance. The hospital is now University Hospital Würzburg, a leading research facility with 1,400 beds. The plaque shows a bronze relief of a German nurse and American medic working together over a patient. The inscription appears in both German and English. Here in April 1945, enemies became healers together. Medicine knows no borders. Fresh flowers appear at the memorial weekly, left anonymously by people who understand that some moments in history deserve continuous remembrance. The hospital has never refused a patient based on nationality since April 1945. That policy, established 80 years ago through crisis and transformation, remains absolute. New staff members receive orientation that includes the Würzburg story. Ethics training references Maria's journey from refusal to protection, using her transformation as a teaching tool for healthcare professionals facing their own moral choices. Reunions occurred at regular intervals. In 1965, Mitchell returned to Würzburg and met with Maria. They had not seen each other in 19 years. They spent 3 hours talking in the same chapel where Maria had made her decision. In 1975, Sergeant Kowalski visited Germany and met Elizabeth Hartmann and her son James, the baby whose life had been saved. Kowalski held the 30-year-old man and wept, overwhelmed by the tangible proof that medicine had defeated hatred. In 1985, a 40th anniversary ceremony brought all surviving participants together. In 1995, the final major reunion occurred. Maria was 84 years old. Mitchell was 78. Maria Steiner died in 2001 at age 90. Her obituary noted that she had changed German nursing through moral courage, demonstrated in a single decision made during 4 days in April 1945. Her gravestone in Würzburg reads simply, "She chose healing over hatred." James Mitchell died in 2008 at age 91. He received the Presidential Citizens Medal in 2006 for a lifetime of humanitarian medical work. His obituary quoted his most frequent statement about the war. "In Würzburg, I learned that medicine recognizes no enemies, only patients." James Hartmann, the baby saved on April 12, 1945, is now 80 years old. He became a pediatrician and still practices part-time in Würzburg. He named his own son Mitchell. Each year, he gives a lecture to medical students at the university. His message never changes. "I exist because an American medic decided that babies have no nationality. That principle should guide every medical decision you make in your career." Greta Albrecht is still living at age 102. She is the last surviving nurse from those 4 days. In a 2024 interview, she said, "The Americans taught us that medicine has no nationality, only patients who need care. That lesson shaped my entire career and should shape yours." On April 12, 2025, exactly 80 years after Maria stood in a courtyard refusing to treat dying Americans, University Hospital Würzburg will treat patients from 63 different nations. No patient will be refused based on nationality, continuing a tradition established through transformation and maintained through commitment. The memorial at the entrance will receive fresh flowers, as it does every week. Medical students will gather there to hear again about the moment when enemies became healers, when ideology gave way to ethics, when a German nurse chose patience over politics, and proved that medicine's highest calling transcends all boundaries.